If we are speaking about modular implant, we must speak about new trends in alloplasty. New trends in alloplasty bring with modern bearing surface, metaphyseal fixation, resurfacing also, and modular implants. For instance, in resurfacing, you have many implants which are just the same practically, instead some of them which are not used very often. So I think it will be the same in modular stem. First modularity concept was, of course, rechangeable heads, as Karl-Heinz has spoken about, which allow a lot of sync and, for instance, decreased frequency of dislocation. But if we are speaking about modular stem, we must speaking about rechangeable necks, which can allow us valgus varus position and offset setting, which can allow to change anteversion, retroversion, or rotation, and of course this combination could bring also lengthening of the extremity with total hip replacement. There is also some concept which can use rechangeable trochanteric part. It's mainly used in revision stem, where there is also modular trochanteric part of prosthesis, which can reach good length, good rotation, and thickness of the prosthesis, which allow replacing an bone lost part. You can see that we can treat with this prosthesis lots of problems which we have without any large complication. Modular socket is also one of the concepts, but we shall not speak with that. Also, it will improve stability and improve healing of the prosthesis. Of course, modular concept has some disadvantages. For the producer, it's too big stock, too many possibilities, too many choices, and it's very difficult for many surgeons. Of course, they could be fatigue fracture due to lower straightness of the cone in the neck. And of course, there will be one disadvantage: the price, which is made from too big stock, which is necessary for each surgery. What is indication for modular implant? Of course, the main indication is deformity of upper part of femur, postdysplastic arthrotic changes of the hip joint, changes in acetabular orientation, and of course we must say surgical mistake actual during surgery or during preceding surgery. New concept bring modular neck from primary prosthesis. It brings possibility to change neck stem angle, possibility to change offset and length of the prosthesis, and possibility to change the anteversion or retroversion. Problems is only with fixation of this modular concept and stability of the prosthesis. We have some experiences with this type of prosthesis, which is very nice, and you can implant the stem in upper part of femur, and then you can decide which type of necks you will use to be sure that your hip is well balanced, in good lip length discrepancy, and in good movement. You have, for this reason, modular neck, rechargeable neck, which allow, of course, several position, 4 position of the head and 5 position of the rotation. So you can have a lot of combination. I think this is the most modular concept in up-to-date production of hip prosthesis. You can see that the rotation could be made of 15 degrees each side. So you can have really good choice how to balance and how to well fix your hip prosthesis. That is the concept of simple cone, which is implanted in the stem, which could, with one neck, make 4 degrees or 5 degrees of rotation. It's one big advantage. Of course, other producer could make only two possibilities, because here is some short stem which can be fixed in in the hole here. So it's another concept, but the first concept has bigger advantages, of course. For the better stability of the rechargeable necks is a good concept, the bicone. Bicone, which is not only one cone of fixation of the neck, which is much more stronger, of course, because it is bigger, but he has less variability. And if you want to reach so many positions as we have in the simple cone, you must have many bigger stocks. So that means it is much more expensive, this prosthesis. Here you can see in this nice table, you can see how you can make your desired offset or lengthen of the extremity. You can combine length of the head and combine valgus position or varus position of your neck to reach desired offset or desired length. It's sometimes very complicated, and it's necessary to make very accurate preoperative planning. We use this type of stem, which are modular cone modulated from titanium. The neck has 4 variants: valgus lateral, varus, and standard, and anteversion could make 5 positions. There is also available monoblock prosthesis in standard position, and I think that it is one of the very big advantage of this type of modular stem. You can use the modular stem, of course, for the so-called standard osteoarthritis. It looks quite good. But you can really use it for this type of prosthesis when you reach this is lateral valgus neck, when you reach the position which is for the patient and for the hip the best. If you don't need it, you can go back to monoblock prosthesis and you get the same position of the prosthesis, but with very, very not so expensive prosthesis. So it is very big advantage. Here you can see where we can go with our head, with the position of the stem. Here are some another type of modular neck prosthesis. This bicone, another bicone, and the prosthesis with the bicone neck also. Here you can see some typical cases which are indicated for using modular neck. You can see very big deformative arthritis post-dysplastic. You can see that the fixation is very well. And you can fix your stem as is possible, and then you can slightly correct the position if the upper part of femur is deformized. So I think it's one of the big advantage. To the conclusion, modular prosthesis allow ideal fixation of the stem in irregular upper part of femur. If you need to change, it's very simple how to do it. Changeable neck allow correct positioning to head to physiological situation, to responsible position of socket. Changeable neck could improve and correct relationship between head and socket, so it is the big advantage which you can use during your surgery. If the position is near to normal, it's better use monoblock stem because you avoid potential risk of complication, of course, and you save your money in your pocket. The decision have to be made using trial prosthesis or trial neck prosthesis or trial head, as Karl-Heinz Widmer has showed here. Good prior policy use complicated prosthesis. It's when it is necessary, is of course allowed. But when you don't need the modular stem prosthesis, you can use standard prosthesis. So this is I think very big advantage. One of the more advantages in this system which we used in our clinic. Thank you very much for your kind attention. And I will ask Frank Rauchert